General anesthesia refers to a certain drug that, when administered, results in a state of regulated unconsciousness and a loss of body sensation. It is induced through special drugs mainly during major surgical procedures. Patients undergoing major surgery are usually given general anesthesia so that they don't move or become aware of pain. Recently, however, some doctors have been using hypnosis in the operating room without administering any painkillers at all. Craig Anderson reports.
Hypnosis is not a recent medical innovation. It was first used as a surgical anesthetic in India in 1845, but was quickly forgotten shortly after the discovery of ether. Ether is a substance often used in surgery as an anesthetic. However, many scientists now admit that not enough is actually known about the long-term effects of anesthesia and suggest that there is room for alternative therapies and techniques. For example, several studies from the US have indicated that anesthetics have a negative effect on the immune system. Tonight we have Dr. Angela Davidson, an anesthesiologist who will be telling us more about hypnosis, a procedure that is still controversial.
The purpose of using general anesthesia is to enable the patient to comfortably undergo surgery while being unconscious. However, we know very little about the long-term repercussions of these drugs. Many anesthesiologists today have increasing doubts about the whole idea of putting people into a pharmacological coma. Even when one thinks about the advances in chemical anesthetics in recent years, it seems a bit unusual that anesthesiologists would even think of using hypnosis as an effective alternative to general anesthesia. Nevertheless, hypnosis was officially sanctioned by the American Medical Association in 1958 to help alleviate various disorders such as depression, migraines, and chronic cancer pain. Actually, it was in Belgium where the surgical use of hypnosis really prospered. Since the early 90s, a team of doctors there have performed over 5,000 surgeries using a technique called hypnosedation. This technique replaces general anesthesia with hypnosis and a very mild sedative or a local anesthetic. These doctors have come across some amazing advantages of hypnosedation, including reduced bleeding, which makes surgery much easier to perform. In contrast, patients under general anesthesia have to use a respirator, and this creates pressure in the chest, which increases bleeding. In hypnosedation, patients breathe on their own. Most patients who were hypnotized and underwent a major operation weren't given any painkillers at all, and yet they felt no sensation whatsoever. They also had fewer side effects than fully sedated patients, and they recuperated nearly 50% faster.
Wow, that's amazing! Is this procedure suitable for anyone who's about to have an operation?
No. Some doctors believe it would be an alternative for those who are allergic to conventional anesthetics. However, even strong supporters of hypnosedation do not recommend that it should replace anesthesia completely. You see, not everybody can be hypnotized. Studies show that about 60% of people can be hypnotized to a certain extent, and another 15% are highly responsive. The remaining 25% don't appear to be receptive to hypnosis at all.
Despite all the evident advantages, doctors and scientists are still not taking hypnosedation seriously. Most scientists claim that there aren't enough well-founded clinical studies available. In essence, whether or not hypnosedation becomes a practicality remains to be seen.